So how do you avoid another bout of lower back pain, possibly sciatica? There's a few simple tips I'm going to give you very soon that'll kind of decrease the likelihood of this coming back. And what we do know, unfortunately, is that back pain and sciatica, when they come back for a second episode, it's typically worse. But what I say is they haven't gotten the tips and the advice to really change or reduce the chance of it coming back. So I want to give you a few things that you can work on. Some things apply to you, some things don't. But if you can embrace, these simple things, oftentimes we can decrease the likelihood of that coming back. And we'd hate to have you stop what you want to do, especially as the world is opening up and all that and COVID's going away. We want you to get back to everything you enjoy doing. So here are some of my tips. Okay, one of my first tips are just lower BMI. Less weight in your joints. It's been shown a little less pressure on your lower back. You typically, those people have a higher chance of having back pain or coming back. So let's really embrace that. And it's funny, people say, well, if I lose some body weight, will that necessarily cure my back problem or help my back? Less weight and a healthier weight, I want to say healthier weight, you'll feel better overall, whether it may be heart function or anything else, you will feel better. So I would embrace that. I think that's just a good wellness type thing, but it's definitely something connected to the back. Back, knees, a lot of joints. As you have more body weight, unfortunately, it puts more pressure. So let's look at that. That's my first tip. And magically, he has a spine. Okay, so one thing is to stop smoking, okay? If the problem is coming from the disc segments or even some of the surrounding areas, those disc segments have a blood supply to it. And they found in smokers, they feel that blood supply is affected by a smoking history, all right? So by reducing the smoking, this area can heal or decrease the chance of it coming back. In fact, one of my old professors at the University of Miami, the guy was a neurosurgeon, said, I don't actually do surgery on anyone for spinal conditions if they have to have like 2 or 3 months of not smoking or at least going on the patch. So there's definitely something there. We can reduce that. You may actually feel better. And guess what? Just like the extra body weight, if we stop the smoking, probably better for us overall as far as health. We can actually be more active, probably exercise a little easier. So hey, stop smoking. So with most conditions that are orthopedic related, there's a degree of inflammation. So how do we control that inflammation? We can take anti-inflammatories, which is fine, but taking those anti-inflammatories a lot can actually cause other problems in our body, liver toxicity. It's just not good, bleeding issues. So what can we do to decrease that inflammation and hopefully the inflammation that's around those nerve roots in our lower back, allow that area to heal? What can we do? And there's some evidence for deep, slow breathing, which is actually one of the videos you'll see in our description. And basically, by getting and reducing our respiratory rate, by doing a very easy breathing and working on reducing our respiratory rate, I like to do square breathing. That will reduce what they call the sympathetic drive. And the sympathetic drive is just part of the nervous system that is our fight or flight. It's like you fight, you're moving, it's your action, and that stimulates more cortisol and inflammation and cytokines. Fancy word for it. More inflammation, probably more pain. When we do this deep, slow breathing, we want to get to that 6 to 8 breaths per minute. We get the parasympathetic, which is on the other side, and it's our relaxation portion, our eating, our calming. And we get that parasympathetic to act a little bit more, we reduce the inflammation. So if you have a back condition, just to kind of work on that relaxation through deep, slow breathing can really make a difference in what they feel, the inflammatory factors. Less inflammation, hopefully less back pain, hopefully less pain in many areas. So sometimes it's not so much about what you do, it's what you don't do. So any activities that are repeated flexion with rotation, like sitting in your car and you're trying to get something on the passenger side and you're too stubborn to get out and walk around, you're trying to reach for it as you're driving and you're reaching and you're flexing and rotating, that combined motion of the spine when you rotate and flex puts the lower back in a position that it's not as resilient. It just can't take that loading. And if you do something like that in your life, whether it be part of your gym program, maybe doing Russian twists where you're up and you're rotating with a medicine ball, or there's an activity you do for work, repetitive activity. If we can reduce that, especially when you're noticing, wow, it seems like after I do that, it's a little problematic. That combination of movements are just not great for the lower back, especially with any kind of disc-related problems. So let's reduce flexion and rotation, and let's see what happens. If we can keep everything kind of in neutral, so when we're reaching, we're changing our position and coming down, not doing a lot of flexion where we lose that natural position of our back, But especially the combined position of flexion with rotation, big no-no. Try and reduce that, especially when you start noticing some symptoms. But if you try and get in the habit of moving better, I call it good spinal hygiene. I took that from Dr. Stuart McGill. That can make a difference in your day. So what the next tip is know thy triggers. So what is a trigger? A trigger is something that makes your back worse. Okay, if you keep on, I give the analogy, and this is an old analogy from another practice, Robin McKenzie, is if you have a cut on your knuckle, and you know at a certain point you keep on bending it before that scar tissue is formed, you kind of open up the wound and you kind of delay the healing. In the early stages, we've got to figure out what can we do to know what the triggers are, or once it's triggered, what can we do to allow that area to heal? Okay, we're trying to put the back in the best position for it to feel better. If it's healing, and also knowing what actually causes the wound or the cut on the knuckle. What am I doing that possibly led to this most recent episode? A lot of times you're just sitting, you know, and using a good lower back pillow or getting up, you know, frequently will make the difference in how you feel or what triggers it. It could be that you're going to a very, very low squat, not even with a lot of weight, that very low squat, your spine is in a certain position, and that triggers. You know, what is the trigger for you? And knowing that is so important because that's very much you. You have to understand and really be a good historian and understand what am I doing that might be contributing to this and making things worse. If you could figure that out and modify it, you can be in a better position. So anyway, so consider that, know thy triggers. It's really important to understand what sets you off, what activity. Sometimes it's not one activity, it's the one activity you do for too long. So consider that and really delve into that. A lot of times you can figure that out, and then you want some time for that you know, figure out that movement pattern because that keeps on triggering your back. You may never break the cycle, no matter how strong you are. I don't care how great your range of motion is. You keep on poking your finger in the fire, it's going to get burned. It's not sexy. Go to sleep. Get 8 hours of sleep. Try and embrace sleep. Sleep is important. Sleep is pivotal. They show when people don't get enough sleep, their injury risk below 8 hours goes up 3 to 4 times for athletes. It is an integral part of health and healing. If you're not getting a good night's sleep, that's a problem. So I really want people to kind of make that commitment, do a little meditation before you go to sleep, really set the environments that you're going to have the best quality sleep and be energized. When I have a good night's sleep, I feel I could take on the world. When I don't, like when my kids were 6 months and didn't sleep for the whole year, they didn't sleep through the night. I was tired, I was achy, I was not at my prime. Not exciting, it's not a great massager, it's not a cream that you can put on your body, but sleep is pretty good, and sleep will make a big difference in you if you embrace it. It does have to be every night, but you should get into a sleep ritual, meditation, not using electronics, a couple things just to set up the environment that you're going to feel better. My wife laughs. I got the sleep mask on. I got the little tweezers so I can put them so I don't hear anything. I mean, I try and do it. It's not pretty, but it can make a big difference in your sleep. So embrace sleep. Get the 8 hours. It allows everything to restore and reset. So oftentimes, you know, with a variety of conditions, sitting is a new smoking. We've heard this over and over. Beaten to death. Anyway, the biggest thing with back problems is that you don't want to be in one position too long. Dr. Skelly Starrett talked about this in his book called Deskbound. Love it. His idea was to kind of change your position frequently throughout the day. If you could be in a bar stool situation with an elevated desk, you can be on the computer this way. Maybe then you'll have a regular. Maybe then you put the desk a little lower later on. Maybe you do a standing portion of the desk when you're more upright. Always changing and fidgeting and changing your position. The body was meant to move. So if we can set up a situation where we're always